It's a common question, probably the question I'm asked the most. Doctor, is this normal? Should I bring my pet to see you? Well, chances are, if you're worried enough to ask, you probably should have them seen by a veterinarian. Hi, I'm Dr. Shelly Rubin. Pet owners ask me every day, is this normal? Should I bring my pet in? It's a good question because, well, we can't ask our pets how they're feeling or what's wrong. We can only rely on signs that the pet shows. And let's face it, no one is better equipped to interpret these signs than your veterinarian. Let me tell you about some of the common signs to look for and when it's necessary to take your pet to the veterinarian. One of the most important things to be on the lookout for is any sort of change in your pet's behavior. Maybe your dog is very outgoing, and all of a sudden they start to seek seclusion and get irritated when you approach them. Perhaps your cat is typically a shy cat, and then they start seeking more attention. This might just seem like a small change in what they typically do, but changes in behavior or activity levels could be a sign that something is wrong. If you notice this in your pet, it's time to bring them in to see a veterinarian. It's important to note that cats are especially good at hiding their pain. If you notice your cat starts to walk with a limp or pays attention to one leg over the rest, chances are it's serious. Your cat could be suffering from a fracture, infection, or even heart problems. As soon as you notice any visible signs in your cat's behavior, it's a good bet that he needs to see a veterinarian, so a diagnosis can be made with appropriate and prompt treatment. Like I mentioned before, our pets can't tell us what's the matter with them like we can, so we need to be aware of all the changes our pets display, not only in how they act, but also their eating habits. Just like a change in behavior could be a sign that something is wrong, a change in the way that your pet eats is also a sign that something might be up. This can work both ways. If you find that your pet isn't regularly eating all of their food and is hardly touching the water bowl, or if they just never seem full and are constantly drinking water, there's a good chance that something is wrong. Along with excessive and reduced appetites, noticeable weight gain or loss are also signs of a more serious problem, and a trip to the veterinarian is needed. Other signs to be on the lookout for are lumps or swelling, changes in elimination such as increased frequency or quantity and/or diarrhea or constipation, litter box avoidance in cats, and any abnormal discharges from the body such as bleeding or pus. In addition, signs of persistent coughing, sneezing, or chewing at one part of the body are also signs that need prompt attention. The signs can be physical or behavioral, and most times they are subtle. No one knows your pet like you do, and if anything seems off, it's a good bet that a trip to the veterinarian is needed. Our pets rely on us for their care, but sometimes it can be hard to notice if something is wrong, and sometimes the signs come too late. That's why taking your pet to the veterinarian for routine preventive care visits is so important. You know what they say, an ounce of prevention is certainly worth a pound of cure. For more information on pet health and preventive care, visit avma.org.